today. And this is a very significant issue that needs to be talked about. As you know, we will be talking about with Sean Kiernan, who is the CEO of the Weed for Warriors Project, an amazing organization. You should definitely follow on Instagram.
I mean, granted, I'm a supporter of the Weed for Everyone project.
No, it's all good.
Yeah. I'm just saying, you want to just specify.
Jen has one
warriors.
of her people coming on right now.
I'm just saying.
Which I think this is the first time you'll be communicating live.
Yeah, I don't think we've met.
No, not formally. We've had conversations on the phone, but this is obviously a lot more of an interesting thing because, again, he really is, just an amazing guy who's done amazing work for his fellow veterans. Suicide is the #1 cause of veteran deaths. So, this is, again, cannot stress the importance of this particular issue.
The truth is that veterans really are a vulnerable group. And it's not treated as a vulnerable group in a way that I think it needs to be treated as a vulnerable group.
Let's have less flag waving and a lot more policy making. Yeah. That's what I'm talking about. And that
and
rhymes.
Weed
and I
for
thought
everyone.
of that right off the top of my head, didn't even have to think twice. Without further ado, the CEO of the Weed for Warriors Project.
I think you say president, right?
I'm just another grunt. That's, I think, what we say. I happen to be the guy who I think understands accounting and stuff like that. So I got ushered into this position. But we tend to have a very flat organization, I would say.
Sean, it really is a pleasure to have you. And first and foremost, thank you for all that you do. Obviously, this is, for veterans, this is obviously a very tough day. And, people want to, try to acknowledge veterans in whatever way they think is, possible. I mean, certainly there's a lot of pandering that goes on, but I do think it's important on days like today to point out what can be done to improve the lives of our veterans so that things like suicide become a lot less prevalent and we don't have to be worrying about those that we lose. And of course, obviously having an anti-war message helps as well. So if you could first just introduce yourself, talk about your organization and what you guys do and how you are helping fellow veterans.
Right. So I help run the Weed for Warriors Project. It was founded in San Jose by Kevin Richardson, a Marine who just come off a suicide attempt himself. Found the benefits of cannabis and wanted to sing from the mountaintops its success in dealing with that. And at that point in time, I was working with Dr. Sue Sisley and another vet, Ricardo, on Vets for Dr. Sue Sisley, helping raise awareness of her plight, researching cannabis's effect on PTSD, whole plant cannabis. When we got that funded by the state of Colorado, in 2014, fall of 2000, winter 2014, I met Kevin Richardson at the High Times Cup in Denver, and my future partner and his future partner, the three of us have been running it since. Kevin is more the artsy, creative person. Mark Carrillo is our COO, which basically means he's a Marine and he does the work. I think they call me the president CEO because I get to talk a lot, which the other two don't like to do. So what we did originally was Kevin started a chapter in San Jose, and under the old cannabis rules in California, you needed patients to grow for, and we were a patient base. So we blew up from south to north across the country as disabled veterans, helping disabled veterans access cannabis. And over time, that's changed a bit, primarily because as we've gone to this new tax and regulate model, of high taxes and limited supply, but decriminalizing it effectively, then I think, we are trying to figure out how to create that access. And when you talk about the suicide and overdose epidemic, there's no magic bullet, right? Or magic, solution, but we do have tools, and there are tools we're underinvested in. And obviously being Weed for Warriors, I'm going to tell you first and foremost, in January, UC Davis and Yale published a study in the British Journal of Medicine, I believe it was, showing in California where legal access exists with dispensaries, those opiate overdose deaths were lower. And that mirrors and mimics other studies we've had showing suicides being lower, domestic violence being lower. And these are all common sense reasons when people who understand cannabis and the other illicit drugs that we're talking about here, cannabis doesn't not only not kill, it basically mellows people out. Police used to say we never broke up fights at cannabis events, right?
Right.
and so, you know, when we hear, you know, our universities saying that, hey, we're seeing lower suicides and overdoses and other bad you know, episodes in our community where cannabis is available as a substitute to, you know, not only opiates, but the pharmaceutical approach that carries with us FDA, you know, side effects of overdose, death, and suicidal ideation with the antidepressants. And so, you know, it's not a surprise to us. It's what we live every day. It's what we see. And so if you ask me what's something we can do for vets, is let them have the freedom to choose cannabis as a substitute. The deadly opiates were not only prescribed, then being addicted to, and then you find in my list a market heroin and opiates and the antidepressants and antipsychotics and you know, everything else that, you know, does create by the FDA's own admittance suicidal ideation. So it should be no shock where it's highly correlated. They'll always say, well, it's not causative. Well, of course, because studying whole plant cannabis is next to impossible. So, you know, I think from our perspective, it's that. And then it really is about investing in mental health. I mean, if you want to know what it really, I think it is, it's poverty. And when we talk about the enlisted veterans, which make up 95% of our veterans, you're talking about a group that comes from poor Black, brown, and white communities throughout this country, working class communities. And I was born in 1972, so I do remember a lot of this, but you know, we started cutting the social safety net back in the early 80s. And we, you know, shut down mental hospitals. We underinvested in these our communities, and we basically cut resources. And so when you take these veterans from these communities and then dump them back into these communities, it should be no wonder that they're suffering at a higher rate, much like their brothers and sisters who are non-veterans who come from these poor areas are suffering of a higher rate. So there's very much a class issue in here. And that's the unfortunate thing that I see, having been on both sides as a grunt RTO in the jungles of Panama to working in a hedge fund on Park Avenue. You know, you've seen both sides of the extreme, and it's bad. And it's worse than I think most people realize, because you don't have a perspective how bad it is, most Americans. And I think that's something that's shocking to me, how in this country we let that continue.
Yeah, I think in general. Oh, something's
echo on your end, Sean.
You got to turn it down a little.
I'll turn it down. Is that better?
Yeah, that's better. Okay. So the thing I notice is that now that we're starting to see legalization, either medicinal legalization, recreational legalization, whichever it is, that is not, as you were indicating and you alluded to, the entire problem, because they still don't have access to it. It's because it's not something that is sort of given as a treatment option. It's not a preferred treatment option like your opioids that will be given to you at, low, copay cost or whatever it is. In order for people to get cannabis, it's like ridiculous. So even if you're allowed to have it, that doesn't mean that you can get it. And I think that's a huge problem. And especially when you're talking about the idea of like the class consciousness and understanding the poverty level of a lot of people. First of all, a lot of people that go into the military, they were poor to begin with, and that's why they went in there. That's unfortunately our jobs program in this country. And so, a lot of the people are already coming out of poverty. People that have means and education and lots of opportunities, it's not always, generally don't go into enlisted service. That's just not the norm. So these are already poor people, right? So then they come out with additional issues, still have no resources. And at a minimum, they should be given weed. Is that,
Yeah, right. I mean, in an ideal world, you would be like other countries that see that not only the therapeutic, but the best policy here, which is the best policy is to provide it as a tool. And why? Because if you're not providing it as a tool, they're probably doing it anyways. They're not supervised, or they're using some other illicit substance that's way more harmful for themselves, therefore their families, therefore the community. And so it just makes no sense. It's kind of like, it's that moral high ground we have that in so much of America, which is like, I always liken this whole discussion to, sex education and the people who believe we should only teach abstinence. Right. And I appreciate moral high ground, and for your kids are great, but we want actual policy that works, and we know it works, right? Access to birth control and honest education. And so when we're talking about this, the sad part about it is they're not doing anything. It's like there's an argument out here in California, which is going to mirror which Florida's model is, which is we're creating these oligopolies. And like you said, you're going from prohibition to cost prohibition. And in many places, geographic prohibition, because in California, 80% of the state, now you can't sell legal access. And that's because we have this thing called local control. And, you know, that works out great. But this is the real problem is, like I said, you have no control, because when you shut down legal cannabis, all you're doing is stoking the illicit market. So you're bringing in the criminality legality was supposed to eliminate. You're denying patients medicine, and it was patients that got everyone to, you know, this thing legalized. And what we've seen is corporate cannabis cozy up with prohibitionist interests to keep that small oligopoly that keeps legal cannabis out of reach as a treatment tool for not only most veterans, most enlisted veterans, but most people in general. And you only have to look at California, the land of weed, and show that 80%, and this is multiple recent, you know, sources, 80% of the cannabis market in California is the illicit market. And so the unfortunate thing with the way we're legalizing cannabis is we're not accomplishing anything but creating an oligopoly to pay off the government and pay off the 1%. And we're still now, the most ironic thing about this whole thing is now industry is urging localities and states to crack down on the illicit market, keeping the bullseye in the back of the poor and working class that was there before. And no one really says anything in this country because it's the moneyed interest, right? And so the paid for media doesn't, we know whose advertising dollars they're putting in place. But the sad part is that's the thing. It's not even a real policy, because the policy is so dysfunctional that on itself, it should call it into question and eliminate it, right? It's like I said, prohibition hasn't worked for 60 years. Well, what makes you think we're now going to be able to force the illicit market in by offering overpriced weed and keeping the crackdown going on the poor and middle class? So it's actually real immoral, disturbing, dysfunctional news. And the worst part about it is, and I hate to stereotype, but so many of our cannabis advocates come from very privileged communities. I mean, right? People who can smoke pot openly advocate for it, and you know, they're 50 years and older white people, and you see these national organizations, and their perspective is such that they're one of the big organizations in California. We were fighting against in California local control. There was a debate whether deliveries could deliver medicine, cannabis, to a private home in a locale that didn't want them to. And so you literally have a delivery van on a public road go to, let's say, a veteran's house, and these local cities wanted to ban that. They wanted to say you couldn't do that legally. It's setting cannabis access back tremendously for people who are homebound, right? And the amazing thing about it is the state head of this national organization made a deal that said, you know, we'll allow it, and we'll allow these huge funds to crack down on the illicit market. So you literally had a patient's right advocate group giving huge grants to the police and cities to now crack down on illicit cannabis, which, by the way, is the only market patients and poor and working class people use. And it's not our numbers, it's the own state's numbers, it's the own industry's numbers and something. So we're dealing with what we deal with in America, governed by the few for the fewer, and the majority pay for it. And until we wake up as a society, they're going to continue to do it.
Sean, you bring up a really great point, and this is obviously leads to the biggest issue when it comes to decriminalization, even legalization of cannabis, and that, of course, is home grow. It is definitely the silver bullet in many ways, because big industry doesn't want any part of it, and that is what they are trying to prevent. They do not want people, and again, this is one of the signature issues that progressives and libertarians share. They do not want the government having anything to do with this. If you want to be able to have cannabis, you should be able to go to whatever shop that wants to sell it, buy it there, or if you want to grow it at your own home, you do it there. And there should be no monopolization. This was something that I know was very big in Ohio when they were trying to legalize it there, I want to say like 6-7 years ago, and they were basically giving like 7 to 10 companies the right to sell it. So this,
that's how it is everywhere. That's what they're trying to do here. That's what we have here. It's just like, that's what we're talking about. It's an oligopoly on weed.
Yeah, and that of course is the big issue. So if you could talk about your organization and how I would assume that fighting for home grow to be in any type of, whether it's, statewide legislation, federal legislation, is something that's very important to you guys.
Right. I mean, it's with the MORE Act, which I applaud all the cause, what it was trying to accomplish. Again, I just think we need workable models. And so the home grow aspect is really the last resort, right? And it should be a no-brainer, because at the end of the day, but the problem exists is we have a very restrictive supply. And like you said, there's now financial incentives to restrict that supply. And so to the investor, they don't want any erosion of their market share, and forcing people to buy in their dispensaries makes sense. Remember, that a big part of this, though, is this whole tax and regulate model that was pushed on us. What was also pushed by the American Medical Association and these organizations that felt high taxes would be restrictive. And there's an old saying, when your doctors start talking about stocks, get out of the stock market. Well, when your doctors start talking about taxes, maybe we should rethink. They may know something really well, but they don't know something else. And there's a Stanford psychiatrist, I won't name, there's no need to do it, who's a big champion of this. And he thinks they can control this and that you can't control any of this. So the problem with all these things, and home grow is so important, because you're not stopping it. It's happening anyways. All you're doing is criminalizing whole sects of people. All you're doing is creating police encounters, right? That unfortunately for a big swath of enlisted veterans who don't happen to look like me or you, that's a real dangerous situation, right? Yes. And at the end of the day, home grow is essential for people if you want to keep this oligopoly model. But the key point is none of this stuff they're proposing is good public policy by the numbers, by the evidence. And so what's going on is they're buying votes, and our politicians who bear hug veterans, Democrat and Republican, to be honest, I'm very disappointed with the neoliberal portion of the Democratic Party, and they hug us. And yet they push and vote for policy that is flattened just against our interest, and say they do it in our interest. And yes, home grow is essential because it's the only way people can afford it, but it's how home grow is done. For example, in California, they said they gave us home grow, but it's 6 plants per house. And by the way, if you rent your house, the landlord can tell you you can't grow. And every landlord, because their insurance policy is going to say that, right? Right. And apartments, now you can't even smoke in 90% of them in California, your own apartment, because of the nanny state. And you're sitting there going, this is absurd, the control people think they have, because you're not controlling it. All you're doing is creating a whole swath of people who now are disenfranchised and viewed as people not behaving like our government wants them to behave. And that just cascades into other problems. So yeah, home grow is important. But what's more important is we just recognize the reality of what's going on here. And you basically decriminalize possession in these states because now people can use it. And you think you're going to control supply and charge 3 to 4 times the real market rate and think you're not going to have an illicit market. This is basic economics.
Yeah.
What would be your message for anybody who wants to get involved with your organization? What is your ultimate goal right now in terms of
what are your projects? Like what are your projects that you're working on?
So one of the big successes we've had in California is SB 34. And what SB 34 does is open within the track or trace model a donation. So it allows the brands to donate cannabis to veterans or any patient who has a medical recommendation. And so we've done events you can see on social media where we're getting bags of cannabis to veterans at once, twice a month, and up and down the state. We just had one in this weekend. We had West Hollywood. We had Lompoc, which is in Santa Barbara County. We had Modesto on Saturday, and we're doing San Jose tomorrow. And 50 to 100 vets get bags that can up to $1,000. What this allows them to do is therefore take their limited disposable income and buy more meds for the rest of the month. So they literally can now medicate on cannabis over anywhere from 8 to 30 pills they'd be taking a day at the VA. That's a model we want to expand to states like Florida and expand to states like, Nevada and Massachusetts where the pricing's an issue. So that's a big success. The other thing we're doing is we're starting a talk of an initiative. We've invested in a drafted initiative to fix Prop 64, which is California's legal cannabis model. And we do that by loosening up regulation and the taxes and financial burden to allow industry to compete, because you do not have an illicit alcohol market in the state of California because it is accessible and affordable. And that's best public policy, to have it within the law. And so that's what we're really focused on, is access. And then we will continue once COVID lets up in the state of California. On the middle of this month, they'll open up. We'll start to do events again. In fact, we have one going on Friday where we bring veterans together and really get them to mingle, because it's not the cannabis that heals. It's the cannabis that allows these veterans to create the network and connections that they're dearly missing, that social network that they were used to because they had a band of brothers and sisters. And when you get thrown in our society, very disconnected, they lose their way. And so it brings people back together to help each other. And that's just the focus of what we do.
If there's anything that we can do, obviously we definitely would like to connect with Brendan, we have spoke with before. That's obviously down here in the Miami area. One of the things that we did do prior to COVID really taking off was we were helping at the Veterans Hospital, and that's something that.
And then that, of course, got shut down.
Yeah.
But
so anything that we can do going forward, obviously, we want to continue to build this relationship with you guys. We think what you're doing is absolutely fantastic.
See, I would be very hip to the idea of weed donation.
Weed donation is definitely.
I'm collecting. Yeah. Look, I am actually in the process of collecting hygiene packs and socks and stuff to be doing regular homeless disbursement. And I would love to live in a world where I could put a little bag or a blunt in each one of my little hygiene packs.
Sean, I can assure you that what we're doing with GenCore, that if we do something with the veterans, it will go directly where it belongs.
Oh yeah.
So if there's anything in particular that you think we could do, especially down here at the local level, and potentially expand that, sort of like set the model.
Keep us apprised.
Yes, please do. Like I said, we're happy to communicate with Brendan. We really appreciate what your organization is doing. You guys are absolutely phenomenal. And as I like to say, it's easy to wave the flag. It's even more impressive if you're willing to put some teeth into some of these primary issues that are of great concern to veterans. We need to have less, need to be remembering so many veterans on a day like today. We would like to prevent veteran death, and I think we can really help with that by
Weed for Warriors.
Weed for Warriors. What more could you say?
We need to get Jen elected over Debbie, because she's for hell not helping us.
No, she will never be your friend.
I think if there's one thing that we can say that is a distinction between Jen and Debbie Wasserman Schultz, is that Jen actually believes in civil liberties and Debbie does not, or her corporate donors do not, and she just obliges. So it's the same thing. But with that said, we were very grateful that you came on the program this evening.
Thank you so much, Sean.
Guys, remember, WFWproject.org. Please go check out Sean's organization.
Be a lover, be a supporter, be a weed smoker.
Well, please do. We insist. And then, I guess so. We do
be
insist.
A weed partaker.
Life is obviously a lot easier with cannabis.
Yes.
So what can you say?
Yes.
It is. And veterans, you want these veterans medicated in your community. They are happier, they are nicer, and they're better neighbors. Hi. And just leave them alone if you don't like it.
Yes. Thank you so much. Perfect ending.
Perfect ending.
Thank you, Sean.
My friend. Have a great day. See you, brother. And thanks for your service as always.
You got to remove.
Yes.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.